There are 206 bones in the human body, all of which serve the purpose of providing us with structure, support, and protection. Take the skull, for example. Personally, I'd be pretty scared not to have a skull. I mean, could you imagine walking around or playing sports with no protection for one of your most vital organs? The rib cage is also very important when it comes to protection. The rib cage protects two vital organs, the heart and the lungs. But not only are the bones crucial for protection, they also serve as our body's source of blood. Yes, long bones are responsible for making blood cells, erythrocytes, leukocytes, and platelets. An adequate blood supply ensures that nutrients like glucose and oxygen are all delivered to our cells, and harmful byproducts are carried away. So as you can see, without our bones, we would have no blood flowing through our veins, nor would we have the protection that we all rely on.
Bones are very similar in structure to rock. Not that rock. That rock. But unlike rocks, they need to be taken care of. Now, it's very simple to take care of them, and you probably do these things already. So, you can tan. Your dermatologist might hate you, but your bones will love you. When you spend time outdoors, you allow sunlight to be absorbed into your body, and that will be turned into calcium for your bones. Also, just keeping a healthy body weight, exercising, having a healthy diet, not smoking, all those things can also help keep bones healthy. Ingesting foods that are high in vitamin C, K, and D can also help. So fish, dark leafy vegetables, and dairy products fortified with vitamin D. So when you're caught at 2 a.m. eating ice cream, you can just say, oh, I'm just trying to keep my bones healthy.
In a long bone, the shaft is called the diaphysis. The endpoints are the epiphysis. Where these two meet is called the metaphysis. This consists of calcified cartilage, epiphyseal disc, and that's where the bone is. When the bone ossifies, the linear growth stops. To keep the bones healthy, the skeletal system needs calcium, like Halle stated. But what makes the system unhealthy? Well, lack of exercise and activity can lead to brittle bones and also weak bones, which can lead to osteoporosis. Many think that this is the only way that the skeletal system can fail, is by broken bones or having a fracture. But the skeletal system is much more crucial to homeostasis.
Imagine if every day you woke up with glass bones and paper skin, and every morning you broke your legs, and every afternoon you break your arms. That's what osteogenesis imperfecta does. It's a disorder that causes your bones to easily fracture because the cells in your bones don't produce a proper type of tissue that give the bones their strength. There are no known cures for this disorder, but there are several types of supportive treatments. One type of supportive treatment is called rodding, where a surgeon implants metal rods into the legs to give them extra structural strength to be able to support the body and be able to less easily fracture.
It's important to keep your bones healthy because the older you get, the weaker your bones will be. And it is important to keep bones healthy because as you get older, your bones tend to get weaker and they can become so weak and brittle that they break. So what would be a minor fall turns out to be a major fracture. Osteoporosis is a disease that is caused by not getting enough nutrients to the bones. Some symptoms include abnormal curvature of the spine, back pain, and a fracture that happened too easily. It affects about 44 million men and women in the US, and it can be easily treated through prescription medication and getting the nutrients that you need.
There are a plethora of different disorders that can plague the skeletal system if it is not properly taken care of. Another example is aplastic anemia. Aplastic anemia is a disease that deals mainly with the bone marrow. It stops working altogether. This is a problem because without functional bone marrow, no new blood cells are being produced. And no new blood cells means that we are more vulnerable to infection and we can't get oxygen to our cells. So, as a way to treat this, the most common treatment for aplastic anemia is a bone marrow transplant. A bone marrow transplant basically is a way to reboot the body's bone marrow, similar to the way you reboot your computer when it stops working. This treatment has an 80% success rate and is the most common treatment when dealing with aplastic anemia.
Well, I assume no one here has ever had their knee ossified after falling on it. That's because fibrodysplasia ossificans progressiva is only found in 1 in 2 million people worldwide, with only 800 reported cases. FOP, or FOP, is a disorder in which the skeletal muscle and connective tissue fuse and ossify with the existing skeleton. This leads to bone forming outside of the original skeleton. Episodes of FOP occur when the patient obtains muscular trauma or falls. So up on the screen you can see the abnormal curvature of the spine along with the extra bone that is formed outside of the skeleton. This is the bone that has formed, that is the excess. Patients with fibrodysplasia often have to deal with the pain of the bones where they aren't supposed to be. There is no known treatment for fibrodysplasia, but patients are often recommended to take pain medication to deal with it.
The skeletal system is the foundation to all your body. Without it, you'd be a pile of slime on the ground with all your organs floating all over the place. In fact, you probably wouldn't even be alive because there'd be no blood in your body. The skeletal system is often overlooked, but it's crucial to our survival. So every morning you wake up, or you see yourself breathing, say, "Thanks, skeletal system."
Thank you, skeletal system, for making my blood cells.
Thank you, skeletal system, for always supporting me.
Thank you, skeletal system, for maintaining homeostasis.